Uh, Good evening, all doctors. Um, okay, my name is Dr. Radha Krishna. I'm a regular doctor like everybody else. I have a master's in molecular medicine, International Medical University. And just can you hold on first? Recording. Okay. So so we have approximately 1 point after 7 billion people on Earth. Around 1.5 billion people have chronic pain. In fact, I think more than that. I believe there are 2 to 3 billion people on earth who have pain, chronic pain. Okay, that's my perception. Okay, this is statistics picked up from internet, and we have around half an hour to complete. So I'm actually presenting a topic on RK Restore, RK Tribiotics, and RK Xero from a developer perspective. That means I have developed these products and talking from that perspective. Okay. And you see, I like to decode. It's very therapeutic for me. I like to go and look at a very complex solution, complex problem, and break it down to simpler solutions. Okay. So my question is: it possible to beat morphine, pethidine, cannabis, and every NSAID? Is humanly impossible to beat, and no one has done this for past 100 years until we got RK Zero. Okay, and numerous occasions it has been able to do extremely well in tough situations where NSAID never worked. Okay, now next topic. Okay, so why are we looking? Why do we need RK Zero? Okay, and because of multiple painkillers are unable to relieve pain, there are multiple side effects, and the symptoms are not relieved with multiple drugs, including steroids, and then we need to develop newer and newer drugs. And the painkillers are especially causing a lot of side effects, okay, and liver enzyme changes or even liver damage. And we lost trust in modern medication because NSAID, one of the studies done on British Medical Journal to show that you induce myocardial infarct. Okay, so it's about how efficient it is. It's not about how potent, how efficient, how speed of it act, the quality, and reduce cost. So I had searched for a solution from a natural healing perspective. Okay, and how is RK Zero developed? I want to explain to you. It took me 3 years to do a research. 3 years, and I went to 10 to 20 pharmacies to look at all the drugs and try to understand why this was developed. What was the mechanism? Okay, it took me to understand multiple pain pathways in the body and how to address all these pain pathways. Okay, so ultimately I've come down to 8 ingredients, and these are some of the ingredients like pepper, pepper, curcumin, clove, pineapple, chili, ginger extract. So what I've done is this is a normal kitchen products that I have taken it out and taken the extracts. So this is not copy and paste, it is extracts from these components. And like curcumin, can you see on your right side? It can address some of the drugs that is going on. Okay, for example, tumor necrotic factor can address Humira. You can see VGF. If you look at the right side very carefully, HERS2 for cancer breast. If you look at on the left side, it addresses inflammatory cytokines, enzymes, growth factors, receptors, addition molecules, anti-epileptic, apoptotic proteins, protein kinases, transcription factors, and others. Okay, so they are natural TNF inhibitors. Okay, and if you look at some of the products from like beta carotene, it's an extract of pepper. Okay, it addresses cannabinoid pathway. It addresses the sirtuin-1, CBD2. It also addresses the tumor necrotic factor, interleukin 1B, interleukin 6, okay, COX-2. Okay, these are some of the inflammatory pathways does it address. So if you look at Boselvia, which is also part of the RK Xero, it addresses aragonite acid. You see, AKBA is acetyl 11 keto beta boswellic acid. Okay, so we have come to a new situation called non-steroidal herbal anti-inflammatory, Okay, so like I said, I love to decode very complex pathways to simplify it. Okay, so what I've done is I did reverse engineering. So I have adjusted the RK Xero according to my teaching. That means I have to adjust the main framework. That means if you are sick, I need to find one or two solutions that might reduce your symptoms or your underlying root cause by 10% or 20% or by 50% or by 100%. So that's the main framework. The minor framework is smaller things like maybe a little bit of joint pain and a little bit of itchiness. Those are minor frameworks. So the major framework is targeted. So the way I've developed is major framework, intermediate framework, and minor framework is how I develop RK Xero. Okay, so until to a point that it has become a very small nanoparticle size, approximately 100 millimoles to almost the size of the red blood cells. So if you want to know the size, here's the size, how a nano curcumin looks like. So the absorption is absolutely fast. Okay, and that is how RK Xero is developed. RK stands for my name, Radha Krishna. Zero means everything in life starts with zero, starts from zero and ends with a zero. And the pain especially should come back to zero. That's my focus. So that is the reason why I found this name. It has taken me 2 years to find this name. Okay, and it's NPRA registered. My product, NPRA is National Pharmaceutical Regulatory Authorities, Malaysia. And I have visited the farm, and this is how RK Xero has developed. It's from the farm. The ground soil has been tested for pH, the elements inside, the acidity or alkalinity, the mineral contents, and this model has been given to the farmers to harvest the ingredients for us. So once ingredients are harvested, we brought to the lab and extracted, and then tested it using nuclear magnetic resonance spectrometry. That is a pharma grade. So what we have developed from a plant, from the ground to the lab is a pharma grade. Okay, and then we measure the spectrometry. Okay, and we have fused all of the molecules together. And these are the ingredients: turmeric extract, black pepper extract, ginger root extract, chili extract, Boswellia extract, pineapple extract, onion extract. Okay, and then if you compare the pain medication and Xero is extremely fast, immediate pain relief, natural ingredient, no side effects, no long-term side effect, does not affect the kidney, doesn't affect the liver, and there's no drug interaction. Whether you're taking 2 capsules of RK Xero or 10 capsules of RK Xero in a day has no side effects. Okay, so the what Hippocrates said that please don't do harm, means don't do harm to human. But do you know when this is a BMJ article, what it says is that in 2017, the risk of myocardial infarct using NSAID. Okay, this is a study done on most of the drugs on COX-2 inhibitors, and they've studied 446,000 individuals, and they have tested. So most likely it's associated with myocardial infarct within the first week. Okay, knowing there's a damage, we still keep giving to the patient. So what kind of pain does the RK Xero relieve? Okay, it's indication. So it can help in migraine, neck pain, shoulder pain, lower back pain, rheumatoid arthritis, osteoarthritis, diabetes, backache, fibromyalgia, multiple sclerosis, sciatica, slip disc, prostatitis, cancer, pain, menstrual pain, Parkinson, Alzheimer's, in fact, everything, almost everything. So if you combine the whole benefits of morphine, pethidine, cannabis, NSAID, and steroid without side effects is RK Xero. because it has crossed every boundaries of pain. Okay, and has been tested. So what conditions can we use? We can use for hypertension, diabetes, rheumatoid arthritis, full shoulder pain, frozen shoulder, osteoarthritis, psoriasis, peripheral neuropathy, Crohn's disease, IBS, tennis elbow, tenosynovitis, backache, gluten intolerance, obesity, gastritis, injuries, injuries plus wounds, breast cancer, lung cancer. Most of the cancers can be used. Okay, so the whole project is very simple. If you can understand a complex situation in a simplified manner. Now, let me take you one step at a time. The whole idea when we look at cardiovascular diseases, all diseases, there's one common denominator called inflammation. So what is this inflammation that we're looking at? Okay. So these are the top 10 inflammatory markers: toxic metals, chemicals, radiation, obesity. The fat causes a lot of inflammatory markers. Gut infection causes inflammatory. Fructose causes high oxidative stress. Liver, fatty liver is inflammation. Oxidative stress is inflammation. Stress alone, we go through stress is alone inflammation. Gluten. These are the top 10 inflammatory processes that goes in our body. Okay. And then what we do, we test the blood for CRP. CRP is not specific. ESR, ferritin level, LDL, LDH, okay, B2 for a lot of markers. Okay, for other markers is like cytokines. So you can see the cytokines. This is for the purpose of studies that I'm planning. Interleukin 10B, interferon, tumor necrotic factor, interleukin 2, interleukin B 6. So the whole list is there. Okay, but this test we are not doing. Okay, and then you look at other factors. If you like a chronic injury, diabetes, you can see hsCRP going out, nitric oxide coming down, endothelin 1. Okay, so all these releases, what does it release? If you look on the left side, you can see it releases interleukin 6, tumor necrotic factor. These are the factors that are actually causing pain or some form of inflammation. So if you are giving an NSAID for this, it may not be addressing them. Okay, so what are the causes of oxidative stress? Obesity, sugar, processed food, exposure to radiation, smoking, tobacco, alcohol consumption, certain medications, pollution, pesticides, industrial chemicals. So if you look at paracetamol per se, what does it address? COX-2. Okay, so where does it address? What is the pathway? So we have to be aware exactly which pathway and what does it address. What about mefenamic acid? What about naproxen? What about gabapentin? If you want to know gabapentin in detail, look at this. Okay, so you can see on the left side it goes through the ascending pathway and the descending pathway is blocked. So this is a spinothalamic tract is addressing. Okay, if you look very carefully, it's a calcium channel blocker. You can see alpha 2 beta subunit. It blocks down there. Okay, so we need to be very specific about it's a neurotransmitter, say GABA. That's it. It's also for analgesics and anticoagulants. Okay, so it's a calcium channel blocker too. Okay, Cerebrex. Okay, these are all you have to know the mechanisms of how it acts. So taking all these in the end, basically it boils down to COX-1, COX-2, arachnoid, prostaglandin, and calcium channel blockers. If I have to summarize, okay. So if you can address the inflammation, we can address through with expensive treatment like exosome, stem cell, IV chelation, peptides, hormones, biologics, okay, disease-modifying rheumatoid arthritic drugs. These are expensive methods of doing things, and not everybody can afford it. If you have the money, it's not a problem. But what about the general population? 99% of the people cannot afford all these. Okay, what does X Xero address? It addresses COX-2, thromboxane, prostaglandin, leukotrienes, interleukin 1B, interleukin 6, tumor necrotic factor, CX3X4, CXCL8, CCL1, CCL2, ONCE pathway, Hodgkin's pathway, spinothalamic tract, thalamus pathway, thalamus, CBD1, CBD2, okay, and TPP-V pathway. In fact, like phosphatidylcholine inositol 3 kinase AKT mTOR pathway. So If you look at pathidine is a opioid. It acts in the brain center. Okay, morphine. Okay, tramadol is a narcotic. Okay, cannabis. Okay, the cannabis now very available in many countries. Okay, so it's a opioid derivative. It addresses cannabinoid 1, CBD 2. Okay, and after giving all the painkillers, we'll end up also giving a PPI. Okay, control off. That means we create a side effect, and then for the side effect, we have another drug. Okay, so generally, when someone approaches me, I actually ask them a simple 3 questions. First question: are you symptomatic? Yes or no? Second question: if you're symptomatic, is it mild, moderate, or severe? The third question I always ask it: if you are in pain, whether mild, moderate, or severe, is it urgent or important? That will decide how I manage patients. Okay. So this is how it is classified: mild, moderate, severe. And then we know the dosage based on these 3 questions. Okay. So then we can start them on RK Xero. Okay. The other product is RK Restore and RK Tribiotics. Okay. So let's go back. Okay. RK Restore and Tribiotics will actually correct the first step. It corrects is mitochondrial dysfunction. So the current one, which has got tribiotics and restore, has been packed with mitochondria. That's why it is different from any other products in the market. Okay, and then we have it also corrects mitochondria. It corrects oxidative stress. It chelates out toxic metals. It removes chemicals. It corrects the cell nutrition. It repairs the gut. It develops exosomes. So 2 products in the RK Restore develops exosomes. One is curcumin, the other is ginger. In the peak, that means at the end of 6 months, when we give continuously, we develop stem cell from the body. Our body's stem cell will heal us. Okay, so let's go back to subdividing the whole process of several sections of pain. Okay, so let me start with dysmenorrhea. Okay, dysmenorrhea can be primary or secondary. These are simple examples where we face them every day, and then we are lost in the number of medications we want to give. So this is primary. We are well learned, all the doctors here. But secondary, we need to find a cause. But no matter whether it's primary or secondary, even after you know the root cause, you can still give. So where does Xero act? It acts on the arachidonic acid and the cyclic endoperoxidases like PG1, prostaglandin 2, okay, and PGH2, okay, prostaglandin 2. These are the factors where it acts. Okay, it also RK Xero also acts on cannabinoid system. If you look at the right side, you see ECS is endocannabinoid system. So if you look at the bottommost cycle, depends on hormone variation, CBD1 expression during cycles, and the failure to upgrade the expression. So if you look further down, okay, it also acts on the potential endocannabinoid pain management as down there. If you look, okay, the other one. So in when a patient sits in front of us, we have to look at the classification. Is it mild, moderate, or severe? And how long do we want to give? So, okay, so we also, if it's mild, we give 2 daily. If it's moderate, you give 2 BD. If it's severe, I suggest you to start 2 capsules during the after the period, the whole month until the next period. And during that period of severe, you can give 2 3 TDS or 2 QID until the period is over, and then continue again 2 every day in the night until the second period and this third period. By the time you come to third period, the pain will come down by 50% to almost 80%. And subsequently, you can reduce the dosage for the subsequent 3 months. That means total of 6 months. So if you can give it for 3 months, it reduces. Now comes down to rheumatoid arthritis. Okay, rheumatoid arthritis. Most of the time, if you are waiting for a seropositive rheumatoid arthritis to come, we have a long way to go. Most of the time, it happens to be seronegative. Okay, and hold on. Seropositive. Okay, and then we have seronegative. So I'll emphasize this on later. So what is the regular medication for rheumatoid arthritis? It's non-steroid anti-inflammatory, COX-2 inhibitors, steroids, disease-modifying anti-rheumatoid drugs, genus kinase inhibitors, biologics. This is the standard management of rheumatoid arthritis. What we need to know is how to look at the root cause and the damage done by the root cause. Most of the time we react to a damage done by root cause. We are not reacting to a for the what you call the root cause. Okay, so if you look at this picture, if you look at the left side, you can see macrophage. Macrophage, when you stimulate, it produces tumor necrotic factor. So for this, they have developed a drug called Humira. Okay, so the same tumor necrotic factor, curcumin, also takes place. So we can give combined. We don't have to discard. We can also give any NSAID, maybe a Coxia, along with RK Xero, until the pain is gone off, reduced, or totally to a zero. Then you can remove any of the NSAID and continue with your RK Xero. Okay, so you can see it also acts on interleukin 6. Interleukin 6, where does it act? It acts the same way as many other drugs. Okay, interleukin 6, okay, tumor necrotic factor. So when you act, it acts on, if you look at the right side, you can see the cytokines, the chemokines, the pro-angiogenic factors, pro-inflammatory factors, okay. So this all it acts, NF, kappa, beta. Okay, can you address it? All is addressed by RK Xero. Okay, for rheumatoid factors, all you have to do is give RK Xero, restore, and tribiotics to remove the root cause, and you can manage with the D3, and minimum 1 month to 1 year, because you have to see whether it's an early stage or moderately mild, moderate, or severe arthritis. For this, we are going to conduct a seminar soon. Okay, so peripheral neuropathy. We have to look at the ischemic part of the nerves, the demyelination, and then you have to look at the other part is inflammatory, the C fibers that's causing the pain. Okay, so these are the changes that's going on in peripheral neuropathy. If you look at the metabolic changes, you see hyperactive several pathways. Polyol pathway is a early part. That means it glucose converts to fructose. Fructose to glucose goes to polyol pathway, hexakinase pathway, and PKC, protein kinase C pathway, in ages, advanced glycation end products. So all these products are because of high hyperglycemia. So that causes structural damage. If you look at the right side, see, we have to control the glycemic burden, the obesity. We have to reduce the root cause first, not managing the damage done by the root cause. Okay, so these are some of the signals where neuropathy forms. If you look at the right side, you have chemokines, cytokines, interleukin 1b, interleukin 2, interleukin 6, interleukin 8, tumor necrotic factor, CCL2, CCL1. All this is addressed by RK Xero. Some of this is not addressed by NSAID. Okay, so this is the drug of choice. If you look at the left side, tricyclic, okay, all these anticonvulsant, opioids, they all are addressing inflammatory pathway, but they're not addressing the root cause. That is the reason why we need to add RK Restore and RK Tribiotics to remove all the inflammatory markers. Okay, and you have to control the diabetes. The dosage can be 1 to 4 months, 4 weeks. Backache, okay, pharmaceutical, it can be management with preventive, non-pharmaceutical, pharmaceutical, non-invasive, invasive, and surgery. Okay, so if you look at the left side is non-pharmaceutical therapy, look at the right side is non-steroidal is the first. Then you're giving a narcotic, opioids, if everything fails. Okay, and these are some of the painkillers they are giving for backache. Okay, but if you look at the left side, you can see all NSAID. So when do we stop? When we say enough is enough? Okay. So in backache, all we have done is give RK Restore, Tribiotics, and Restore, traction, physiotherapy. Maybe you can do a PRP, a duration 1 to 3 months. Okay. For shoulder pain, okay, shoulder pain, quick summary, immobilization, injury. These are the causes of some of the frozen shoulder. Okay. And we are giving NSAID, physiotherapy, steroid injection, PMF, TENS. We are doing everything except addressing the root cause. Okay, so frozen shoulder treatment. Okay, all I have done is these three simplified. We can actually give like stem cell, exosomes, all the expensive for this when it can be done with less than 100 ringgit. Okay, migraine. These are the causes of migraine. We need to look at a root cause, not the damage done by the root cause. Okay, it can be other causes like molds and spores, B2 deficiency, nitrites, sinusitis, abnormal vessels, brain tumor. Okay, so these are some of the triggers and some of the causes of head migraine. And these are the drugs. If you look at the left side, all these are the pharmaceutical drugs. All these are the pharmaceutical drugs. Nowhere does it say that you are addressing the root cause. This is all addressing the damage done by the root cause. What's the damage? Stress. So if we don't reduce stress, you had to add drugs. Okay. All we did is we gave RK Xero, 2 TDS or 2 BD within a day to 7 days, headache is over. Okay. Psoriasis. Okay. For psoriasis, this is a management. Skin, all the focus is on skin. Psoriasis is a metabolic disorder, not a skin disorder. Okay, these are the drugs. If you see on the left side, these are the drugs given, and we cause renal damage, liver damage to a point there's a CKD going underneath. Okay, all we did is with this. If you don't want to, you look at it, you give RK Xero, RK Restore, vitamin D3, and a duration is 1 to 3 months to 1 year. Or you can as well give stem cell, exosomes, NK cells, all kind of cells to take off, and it will cost you $100,000. Okay, this is a case where we done. It took us 9 months psoriasis to this stage using the same methodology. Okay, so fatty liver. Okay, fatty liver. These are the drugs used for fatty liver. You see on the left side and the right side. Okay, we look at the down antioxidants. We have reverse fatty acid. The causes you have to look at excessive. So these are the damage. This is the root cause: excessive alcohol, infection, poor diet, smoking, excessive processed food, fatty acid, poor gut health, diabetes. That's the root cause. The damage is the what you see in ultrasound, what you see in LFT. And we are trying to manage the damage rather than addressing the root cause. So we need to address both the sides. So these are the causes. And we just did B12 injection, D3, and it has solved all so many cases of ultrasound, fatty liver over the past few years. Okay. Autism. Okay. Autism spectrum. We have two frameworks. We have to correct the brain, what's in the brain and what's in the gut. Simple. What have to be corrected in the brain? Mitochondrial dysfunction, oxidative stress, inflammation, neurotransmitters, methylation, chelate the toxic metal, remove chemicals, and correct the brain's speech therapy. See, we need to go into the blood-brain barrier. What can cross into the blood-brain barrier? Okay, in the gut, we need to correct mitochondrial dysfunction, neurotransmitters, HPA axis, methylation, leaky gut, immune, microbiota, and gut infections. Okay, this is how management for autism for neurochemistry or neurotransmitters are corrected this way. So I have developed RK autism child based on thousands of tests. Okay, for Parkinson's. Okay, for Parkinson's, these are the drugs: levodopa, dopamine agonist, anticholinergic. All these drugs are for this thing. They need to address. We need to address on top of this the root cause. Okay, these are some of the drugs for the Parkinson's. Okay, all we did is we corrected methylation, D3, remove gut inflammation, improve microbiota. Because microbiota, when we correct, it corrects the tryptophan, and the tryptophan pathway. Tryptophan breaks down to two pathways. One is it goes to 5-HTP, serotonin to melatonin. The other pathway is to quinolic acid and chironin. So if you look at these two pathways, quinolic acid is neurotoxic and chironin is neuroprotective. So there's an imbalance, and these two are produced by the gut bacteria. So once we correct the gut bacteria, we correct the whole thing. Okay, so simple. Okay, so how to make $1 million? Question. Okay, so if you have one patient that walks into you, okay, one patient, this patient, if you treat rightly, over a period of time, you make 1,000 ringgit, not overnight, a few visits, and they have taken your consultation, your methodology, and you made 1,000 ringgit. Okay, 1,000 times 1,000 is $1 million ringgit. Okay, So you need to earn ₦1,000,000 a year, you need to improve 10 skills to make your life better, to make the patient's life better. 10 skills. B12. So when we give B12, we are charging ₦25 per injection. So 4 injections is ₦100. If you were to give 100 injections for 100 patients, that's all. No, one 4 injections for 100 patients. One patient, 100 patients. That's around 25 ringgit per patient per injection. For times 4 is 100. 100 times 100 patients is 10,000 ringgit. So when you're receiving a phone call from me, that phone call is worth 10,000 ringgit. And somewhere when you didn't call, you didn't understand why you are giving. We have to correct the methylation. We have to correct the homocysteine levels. Okay. Why 4 times a week? Because the half-life is 6 to 7 days. Okay. D3, one injection is 200 ringgit. 200 ringgit for 100 patients a year is 20,000. So 10,000 plus 20,000 is 30,000 ringgit is what's the missing link. Okay. Diabetes. So all these diabetes, hypertension, chronic renal diseases, rheumatoid arthritis, you need to attend the whole seminar. You cannot have half seminar attending, half seminar, or just doctor, I have this case. How do you treat? No, it doesn't happen. You have to attend the whole day seminar. From A to Z, I'll teach you, and then you learn. So what is RKIPSC 2 times 6 times 6? It means that we have taken restore and tribiotic is 1, 0 is 1. You take 2 capsules of 0, 1 capsule of restore, 1 capsule of tribiotics, okay, like this. You give 6 days a week, off Sunday for next 6 months. What happens? Okay, it's a long-term wellness. No matter what you have underneath, it clears out. So at the end of 6 months, you have a better sleep, extraordinary energy, you wake up with full energy. Okay, your bowels are smooth, not foul smelling, you have a better sexual function. It removes most of the underlying root causes by the 3rd month. It detoxifies the liver. Your body stem cell will heal you after 6 months, and you can use it forever. I've been on 5 years on it. Okay.
The lining of the small intestine, like the lining of most of the gut, is a single layered epithelium. Depending upon location in the gut, the epithelial cells, usually called enterocytes, help absorb nutrients from the lumen of the gut, or absorb water from the intestinal contents. In the small intestine, the surface of the lining of the gut is increased enormously by thousands of villi that protrude into the lumen. Here we see a single villus and its internal architecture. The surface of the villus is covered by a single layer of enterocytes, which extend down into the crypt below. Stem cells at the bottom of the crypt, located between Paneth cells, divide and make copies of themselves, and also make transit amplifying cells. The transit amplifying cells proliferate rapidly and move up the walls of the crypt. As the cells migrate upwards, they begin to differentiate into goblet cells and enterocytes. While the cells are moving up the sides of the villus, they carry out the essential functions of the small intestine, notably absorption of nutrients. When the differentiated cells reach the tip of the villus, they undergo apoptosis and are shed into the lumen of the small intestine. The entire process of outmigration and cell death is completed in just 3 to 4 days. The process of outmigration and rapid cell replacement is a defense mechanism against the development of colon cancer, since almost all epithelial cells, including those that have accidentally sustained mutations, are shed within days of their formation. Therefore, the only mutations that can lead to the development of a cancer are those that are retained in the crypt. This dictates that such mutations must block the outmigration of mutant cells from the crypt. The outmigration of transit amplifying cells from the bottom of the crypt depends on the protein called adenomatous polyposis coli, or simply APC. In the absence of functional APC, this continuous outmigration is blocked, leading to the accumulation of transit amplifying cells in the crypt. In this animation of an experiment, APC loss is achieved through an induced gene inactivation, which appears to mimic the mutation that initiates most gastrointestinal tumors. APC is usually required to inactivate the intracellular protein called beta-catenin. The inactivation of beta-catenin permits the differentiation of the transit amplifying cells and their continued outmigration from the base of the crypt. In the absence of APC function, beta-catenin accumulates within the transit amplifying cells, which blocks both their outmigration and their differentiation. The accumulated transit amplifying cells do not themselves form a carcinoma. However, they and their descendants can now accumulate additional mutations that will drive such cells progressively to become full-fledged carcinoma cells.
Okay, so we have come to end of the session. This is a very brief discussion about what RK Xero can do for 10 different diseases and can assist in healing, right? So I need to thank every one of you for attending these half an hour sessions. You can always call me, and I'm Dr. Radha signing off. Can you all hold? Okay, I'm Dr. Radha signing off. Thank you so much for attending this 1 hour, half an hour session. I want to thank you again and again. Just hold on.